Well, I'd like to welcome everyone here to the membership town hall meeting. Are muted when you enter, so you'll need to take yourself off mute if you want to ask questions, or you can put them in the chat and I will ask them as we have time. Feel free to use the chat. This event is being recorded and will be available for you to view or to share with others as time permits. So I'd like to thank Benton Capital, who is our virtual sponsor for this event. And if you know anybody at Benton Capital, help us say thank you for their support of the chamber. So we have two people who are going to speak today, Heather McBroom and Antonio Briseno. Did I say that right? Briseno? Arsenio. Thank you, Doug. I knew I was going to get it wrong. Sorry, Antonio. So
no, it's okay. It's actually Briseno.
It's Briseno.
See, I got it wrong too.
Okay. Well, we'll all have it right by the end of this. So we're going to start with Heather today, and we'll let her take it from here.
All right. Well, welcome everybody. Great to see you all here. Thank you for coming. Hopefully this won't be boring. I know insurance is not a exciting topic, but definitely some good information coming your way. So for those of you that don't know, my name is Heather McBroom, and I'm the founder of Precision Services. One of those companies is Precision Insurance. And I have been an insurance agent in this community for over 21 years. Eek. I specialize in commercial insurance. And so there's been a lot of questions related to COVID and insurance, of course. So one of the first things that I wanted to talk about is, you know, we have disasters happen, and the first place we look when a disaster happens is our policy and says, you know, where do we have some coverage that's going to help us through this? Unfortunately, COVID being a communicable disease was actually something that was not covered under insurance policies. So this was the first time that we saw devastating things happen to our homes, to our businesses, where we had to say, oh gosh, where do we get the help from? And I think that's why we saw such action in grants and stuff to come in, because insurance wasn't going to be an option for a lot of people. And there were several reasons why. First of all, on your general liability policy, communicable diseases is excluded. And this actually came about in 2006 when we had SARS. So it has not been a new thing. It's just something that most of us didn't look at or think about, because who could have even possibly imagined what would have happened in 2020? The second part of the policy that people were a little confused about was business income coverage, and rightfully so. We purchased business income coverage to say, hey, if there's a huge event that happens and we're unable to continue working, we need to still get income. The reason why the business income did not respond is because business income is first and foremost tied to the property side of your policy. So first you had to actually have property coverage. The second part of that was you had to have an actual physical damage to something that caused your business to no longer be able to operate. And that just didn't happen. COVID could be cleaned up. It wasn't something where something was unusable, you just had to clean. And then if you looked on the general liability side to say stuff like, hey, well, now we're not able to go to our offices, the county shut us down, the city shut us down because of that communicable disease exclusion, it was also excluded there as well. So it was very frustrating for people who really looked to their insurance carriers to say, where can I get help? And certainly now that we're all going back to work, people are asking again, what do I need to be concerned about? What insurance coverages can I have now to cover me for COVID? And the short part of the answer is there's not a lot. Those general liability policies are still going to have that exclusion. Insurance takes a while to catch up. They may eventually come out with a policy specific to something like this. Hopefully this never happens again. But that's not really where we're going to find coverage. So the couple of places that you should be looking at and asking your agent about is first employment practices liability insurance. We call it EPLI coverage. And the reason why this is important is because this is what protects business owners from lawsuits against their own employees. And you've got a situation where you're asking people to come back. They may not be comfortable. You might have to let them go. They may come back and you let a customer in without a mask on. They no longer feel comfortable in their position. There's so much going around with, how strict do we have to be as business owners? Do we have to be the mask police? But we want to be conscious of our employees and how they feel. And so we're seeing a lot of claims coming from all of those things related to COVID. A lot of people have never heard of EPLI insurance. And if they have coverage, it's a very small throw-in coverage that may not be able to protect your business the way it should be protected. That coverage is available in a policy all by itself, a more robust policy. And there's definitely some local businesses that may need to look into having a more robust coverage in EPLI insurance. That is probably the biggest area where you can protect yourself now as you're asking people to come back. The second part is cyber liability insurance. And while this was something people should have been talking to their agents about before, it is fairly new to insurance. We've only had cyber liability for a few years, and some agents aren't comfortable talking about it yet. They may not have enough information or know how to read the policies. The policies are all very different. But now we've got people working at home, and they are on home networks, and they are on the same networks as their kids and their kids' video games, and they're running business stuff through the same networks. And there is a lot of people who are getting hacked right now. And there are rules in every state. And depending on where your client resides, you're on the hook for those laws. It's very complicated and not something that I would want to navigate. So being able to talk to your agent about some cyber coverage is really important if you're going to keep people at home or keep kind of a hybrid staff that you might need to protect yourself from any lawsuits and any breaches and anybody who would take your information and hack into it and keep it hostage. So very complicated coverage. There's multiple different what we call insuring agreements that you need to look at and say, which one's right for our business? What are the things that we're concerned about? And those are conversations that you should have with your agent. The last one was workers' comp. A lot of people were like, hey, what if I come back and get sick at work? Well, workers' comp is not typically going to respond. And that's because workers' comp has to have a definite, you suffered an injury at work. And, with COVID, you could have got it at the grocery store. You could have got it from somebody else. So it's really hard to pinpoint you got it at work. And so workers' comp is just not willing to look at those claims and cover that type of loss. Unless you are in a job where you're a frontline person, you have to work with high-risk individuals that have COVID, like a nurse or something like that. We have seen workers' comp policies extend to them because they are obviously in harm's way to do their job. But for most people, that's not going to respond either. So I think having really good policies and procedures, having conversations with your agents, having conversations with attorneys right now is really important because the landscape is very unknown as we move back into working with our businesses.
Thank you, Heather. Antonio, would you like to take over now? And then we'll do questions at the end.
Sorry, I just had to unmute there. Okay, yeah. So, yeah, I agree with Heather. I mean, insurance is not the sexy, fun thing that most people are extremely excited to talk about. I know on my side, it's normally one of those things where we're doing it because we have to, not because we want to. And so trying to, whenever we can actually make that fun is a great thing, if possible. So, so I am a health insurance broker. I do health insurance. I do individual. I do business. I do Medicare, and I also do some life insurance and different things in there. So completely different realm. One thing that Heather and I always agree with, we don't want to do each other's job. So I did actually take the test for commercial for PNC in California. And I was like, yeah, no, thank you. That was a challenge. So let's see. So COVID's been very interesting. You know, with our business, the biggest things that we've seen is just, it hasn't really been COVID related to in the span of COVID, like Heather has seen. Ours have been actually mainly because of the new presidency. And that's where we've seen some changes recently. You know, everyone has been affected by how we have to work with our customers. And so that's no different. For us, a big thing for me is prior to COVID, I was an enrollment center with Connect for Health Colorado. And so there's two of those in the city. And so I've been one of those for since 2014. And so basically what that did is, if you're not familiar with Connect for Health Colorado, they're the state exchange that whether you are a business or an individual, you're able to go through them and enroll for coverage. They did have their shop program where that would work directly with businesses, but mostly it is individual. And so, but I have a lot of businesses, a lot of clients that are sole proprietors that we work with to kind of help navigate to get individual insurance through Connect for Health Colorado. And so that's why I mentioned that. And the biggest difference, what we offered was, since we were an enrollment center, and I still am, we just work differently now. An enrollment center was basically the face for the state. And so someone could walk into my office and actually talk to someone face to face, and we were able to help them with any of their issues. Now, we might have to work with managers and back office people with COVID to fix some situations, but it was a lot easier and faster than just calling that phone number. And because you'd never get the same person again. It was just whoever you got on the call center. And so that's the service that we offered for a very long time prior to COVID. So now with COVID, the difference is, well, we're over the phone. We're still able to offer the same service. So I think we're able to do a better job than the call center in that realm, that we're local. We're still local. So, and you don't know when the call center is. The call centers move around depending on their contract. You know, so, you know, if they get a better contract in another state, well, then that's where the call center is going to be. Well, I'm still in Colorado. I have threatened to move to Florida a couple times, but I'm still here. So we're able to do that, and we're able to help people in many situations where they're just confused, frustrated, and you know, Zoom helps a great deal as well, because we're able to go ahead and still have that face-to-face through Zoom. And so there's one big difference. Another thing that we have seen just recently, so, and this has been, like I said, this is more presidential, the new president coming in, and legislative and new laws coming in. So what has happened is, as of February, I think it was February 1st, everything's been a little crazy, so I don't remember the exact date. But it was in February that the president opened up a new open enrollment period. And so what that did is, for anyone that was not insured at that time could get insurance. So these could be individuals, these could be businesses. And so one of the biggest things I've noticed in the business world, because about 70% of my clients are business owners, anything from individuals, sole proprietors, to brick and mortar. And And so the biggest thing that I've seen is people in this market do not understand how to calculate um, the income the proper way to figure out if they're eligible for subsidies. Subsidies are the money from the government to reduce the cost of the insurance. And so that's something we've seen a lot. And so I've had multiple clients that were business owners that just did not know what to do, didn't know who to talk to. And the person to talk to beside me would have been their accountant. And their accountant did not have the foresight a lot of times to tell them, hey, this is what you need to do. And so I've done a lot of networking with accountants and other insurance agents as well, like Heather. So Heather and I have worked together for a long time. And so the big thing there is so I do a lot of educating and a lot of consulting because, and I offer that because the biggest thing is education and knowledge. If you do not know how the insurance work, if you do not know how the laws work, well, then you're not going to get the best benefit because you don't know how to figure it out. And so what I do is I offer those consultations, and I always have. In the insurance business, and most people don't understand, with us as agents, we don't get paid typically to be a consultant. We sell a product, we get paid. But I know myself and Heather, we're going to go beyond just selling that policy. I know that both of us will go ahead and talk to that client, whether we're going to sell them a policy or not, because it's also being that consultant to help our community. I mean, I had a client yesterday, this is not business related, but it's just to the spirit of how we do business. I had a client call yesterday trying to help her father get into a facility, totally confused, couldn't get the information from the insurance company, couldn't get information from the facilities, calls me up and says, basically, can I hire you to help me with the situation? And I said, well, I'll help you with the situation, but I can't take any money from you unless I sell a product. And she's like, you're kidding, right? I'm like, no, I'm not kidding, but I will fix the problem. I will do everything that I can to fix it. And to my knowledge, it was fixed yesterday. So I didn't sell her anything. So that's the biggest thing that I could say to businesses, and we'll go over a couple other changes. But if you're not sure whether it's a group plan or an individual plan or whatever, or even Medicaid, if you're not sure, ask someone, because there's a good chance you're paying more than you need to. And today is such a crazy, oh my gosh, it's more challenging today than it was 2 months ago because of all these changes. And so that was the first one. So now we've opened up this open enrollment period where now you can buy insurance, because before you had to wait till November to buy insurance if you didn't get it before January. And if you applied in November, then it wouldn't start until January. But we have an open enrollment period right now that's going up until August. And it might go further. California has already said that they're going to go full year. So it's just, they're not going to have a break. And this is nationwide. So this is not just Colorado, this is nationwide. And then I work in 10 different states as well. And so we're seeing these changes federally all over the country. And then, so that's a big thing. So you have this open enrollment period. People can buy insurance if they're uninsured. Now, if you have a plan and if you don't like the plan, that's a little tricky. Most of them, the state has basically said, you got to stay with your plan. There are some other caveats to that. If you have questions, let me know. And then the second thing is April 1st was a new change. And so what happened in April 1st, we had changes to COBRA, we had changes to how unemployment's affected. We had changes to also the APTC, which is subsidies. So once again, subsidies. It's money from the government to reduce the cost of the insurance. With all of our acronyms, I'm sure Heather does. I always feel like it's like the military, where all the different acronyms we're using all the time. And so those subsidies, now what happened is the amount that someone can make, so their income level to get subsidies has increased. So let's say before April, let's say if you are making $100,000 a year, and it's a couple, and let's say you're in your 50s. Prior to April, you would get 0 subsidies. After April, you might get $600 a month in subsidies. Now, hypothetical, I'm not running any quotes right here. I don't have any birth dates, so don't quote me on it. So roughly. Now, it is dependent on age. To get subsidies, there are some factors. So you got factor number 1 is income. Factor number 2 is your tax household size, meaning that how many people you're putting on your taxes when you file them. So it doesn't matter if you have 10 people in your household, if only 2 of them are in the tax household, those are the only 2 that count. And that's another confusing factor, because I always have a lot of time, and I do a lot of consulting with divorces too, because that's a factor. You know, where someone gets divorced and they decide, okay, who's taking what child or how many children? And I always hear about the flip-flop, and I'm always consulting. I'll consult with attorneys, or I consult with individuals and say, look, this is what you want to do to make your life easier and not chaotic. You pick one, he picks one, make it simple. If not, believe me, we're going to have a lot of fun every year, and I'm being sarcastic. And so those subsidies so the tax household, you have the income, and then you also have geographical area. And so those are major factors there. And so that's how we calculate those subsidies. There's a couple other things as well, just to keep it simple. And so if that income, so if we've raised that threshold to get subsidies, now people that were not getting subsidies before now are eligible for them. And people don't know this because there's no one doing billboards, hey, you could get more subsidies. There's no one on the news saying you could get more subsidies. I mean, it's not out there. So prior to COVID, I actually had, I don't know if any of you, I know Heather does because she was on my show. But besides Heather, I don't know if any of the other of you actually even know who I am. But I had a radio show on KRDO as well for about 2 years. And I did it mainly to get this information out because people don't know this. It's not advertised. And so that's another thing I did. Hopefully we'll be doing that again, to get a show going again on a podcast. So I did both, and to educate the community. So what we're looking at, so now we're able to get more subsidies. So people are able to get more money, where they weren't able to do it before. So another factor that has come in, and someone tell me if I'm going over because I can talk. And then, so another factor that we have is now if people are making the same amount of money, but they're able to get subsidies that they didn't get before, that's going to affect multiple types of insurance. That might affect when they decide to retire. That will affect, well, do we really need that group plan for the business? Because you have 5 people that are getting subsidies now that they weren't getting before. So do we need that group plan? Is there another way we can go? Can we use HRAs, health reimbursement agreements? Can we, so when we're talking to businesses, there's a lot of factors here now that are changing as of April. And then also people are getting more benefits if they were receiving unemployment. And so there's a lot of factors that are really affecting a lot of people that most people don't know. And it could save them a lot of money. And if they're saving this, and so if we can save people more money, well, hopefully then they can put it in a good place instead of, blowing it, which we've seen, I'm sure everybody's seen a lot of that lately. So any questions?
Yeah, Antonio, can you hear me?
Yeah, I can.
Okay, yeah, on the subsidy, can two children, divorced parents live with one parent, and does that one parent get a subsidy allowance for two kids, or does that how does that fit into play here?
Okay, so number one, now I'm glad you brought that up, because I want to address that and one other issue. So if they are legally divorced, not separated, they're legally divorced, and the one parent is claiming both children on the taxes, not that they live with that individual, that they're claiming on the taxes, then that is going to be a tax household of 3. If they only claim one child, that's going to be a tax household of 2, and the subsidies are based on that tax household of 2. If one parent doesn't claim either one of them, but they live with them, it's a tax household of 1. And then also another issue we run into that people are not aware of, if you are separated and no longer file, and then you decide to file your taxes, married, separated, you get no subsidies no matter what your income is. Bad idea.
Wow, that's great info, Antonio.
Yeah, it is.
How do things change for us if we get subsidies one year? Let's say COVID was a bad year and we can claim we're poor, and so we get a big subsidy. The next year things go back to normal and we're doing good. How does that affect us? Do we have to reclassify every year with our taxes?
So yeah, so basically the Connect for Health Colorado basically works with the IRS. So I'm very, very, very careful when we talk about subsidies and income. For most businesses, what I tell them to do is I want them to go ahead and do their quarterly reports and let me know where they're at. So because everything is estimated, and if you go ahead and estimate too low, and you end up having a stellar, so let's say you estimate 50, but you actually make 75,000. If you never change that income, you're paying back the money you received on an extra 25,000 on your taxes. And so, and we're always telling our clients, and it was like, another fun experience I had from a client, which was she was actually in insurance as well. It was really funny. She was actually in P&C. And so she gave us her income. The income went up. She didn't tell us what the new income was in time. And the income went up enough that she lost subsidies. And she had to pay back $1,000. And I'm like, okay. And she thought, well, I got penalized or I got fined. I'm like, no, you didn't get fined. You received $1,000 in subsidies that you were not eligible for. You had to pay that back. And now that was the least amount. I mean, that's a small one. I've heard $5,000 and $10,000 and $15,000 because they just did not pay attention. So I always tell all my individuals and businesses, keep track, because if you don't tell me or you don't tell Connect for Health, we don't change it. and you're going to pay it back at the end of the year. I
Mhm.
have no control. You're dealing with the IRS.
Mhm.
So that's the biggest thing is if you're working with me, you let me know how that income is changing, because we're going to estimate at the beginning of the year, see what you're eligible for. And then as that year goes through, then we're going to adjust as needed.
Antonio, we did have somebody ask if you could put your contact information in the chat box.
Sure. Well, and I'm also an official member, so I should be listed
Yeah,
somewhere as well.
We can cut and paste now.
But yeah, I'll put it in. I'll put my my office phone number, and I'll put my my email address as well, and a couple websites.
Okay, thank you.
Sure.
You know, that's one uniqueness about insurance, I think, on.
Antonio,
Yes. Hello?
Go ahead, Candy.
Her screen
okay,
flash.
okay. I'm getting messages on my screen that my connectivity is unstable, so I didn't know if you could hear me. Backing up to Doug's question and talked about if they're separated versus divorced. What if a couple was never married? They have 2 kids and they simply each claim one of them. They live
Right.
separately. You
Right.
mentioned earlier that where they live can affect the amount.
Yes.
Is that county to county, or do you mean state to state?
Both.
Yes,
Because
county to county.
county to county and state to state, because you got to remember the Affordable Care Act is a federal law. So the Affordable Care
Right.
Act is the law, and that affects every state in the country, and it affects all insurance. So basically everything
Okay,
to
but
do
if
with health.
They're insured by employers.
Okay.
They're insured by employers. I was referring back to you talked about the ability to claim them on taxes.
Yeah.
But
So
if you said if a couple separated, they lose that right if they're not divorced. What if they were never married?
so if they're never married and it's going to be considered a common law. Now, I'm not an attorney. I can just tell you what I have seen. But if they're basically
Okay.
common law, I have heard from my attorneys that there are some cases where people that are common law still have to get a divorce. And like I said, I'm not, don't quote me, I'm not an attorney. But let's say they did get a divorce. If they have employer coverage each, and this gets into another sticky situation. If they both have, let's say they both have separate jobs and each employer is offering employer coverage, right? Okay.
Right.
So we have that. And let's say the coverage for each employee is a great deal. Okay. Good companies offering a decent amount. But they're not going to pay a penny for the children. So in that case, what we can do
Okay.
is we can do individual plans for the children, but it's going to be dependent on the coverage that they have through the employer and how that policy looks. So we're going to have to get into the nuts and bolts about
Okay.
that and find out exactly what that the policies of the policy are.
So, Antonio, just to clarify,
That's a lot to digest.
it is. Trust me, I talk to him once a week and still go, what? It's just that tax status
Yep.
of married but separated that makes them ineligible for the program. Any other tax status is okay, correct?
Yes. Yeah. So if you, and it only applies if you're applying for subsidies. So you only apply for subsidies if you're getting individual insurance. If you have group insurance, it doesn't affect you.
Got it.
Okay.
And insurance is such a unique beast in the fact that we all make projections. We guess how much money we're going to make over the next 12 months. We get a estimate of what our insurance is going to cost, and then we get audited at the end and oftentimes owe more money because who
Yes.
has a crystal ball? And that's the same even on P&C. And it's very frustrating. It's to me a very strange way of doing that. And it often leads for people to guess low to get a low policy and then find out later they're going to owe a lot more money, which is not beneficial to anybody.
Right.
Right. And that's why I always offer for my clients to go ahead and do those quarterly reports so that they can let me know. Because if we estimate one income in January, but they do the reports and then in March, April, they tell me, oh, well, we estimated 50, but now it's actually going to be 75. Then we're going to change that. And so now the state's going to have the 75,000, and then we're going to adjust that a premium at that time.
That's great service you provide. Not very many agents are like us and so active during that role. So I'm sure your clients, including me, appreciate it.
Yeah, and then we also do annual reviews, and then we also do the open enrollment. So basically, we have like 2 annual reviews a year, because one, we have an official annual review, and then we also meet with our clients before the open enrollment period as well, so that we can help them and make sure they're getting what they need and getting the right price point. And I mean, yeah, it's really confusing, individuals or businesses. I mean, another business factor is, let's say you have a business that has a group plan and you have 5 or 6 people on that group plan that are over 65 and they're on the group plan. Well, what's more cost effective? Should they stay on the group plan or should they go to Medicare? Well, we do that consulting, so we can actually figure out the factors and let you know what's going to be more cost effective for the business and the individual.
Antonio, I have a question. With all the changes happening with subsidies and all that, now I don't know in the past, for those people who are self-employed or own their own business, they're buying on the exchange the healthcare plans. That's kind of how it works if you're not working for a big company or corporation like some people are. In my case, I work with Antonio to get my own health coverage through the plans that are available on the exchange. But there's also a point where if you hit a certain mark of what you earn a year, you don't even qualify for the subsidies. And are you saying that has changed now?
Yes. So what has changed is the threshold for the amount of money that you can make in a year has changed the eligibility for subsidies. And it's changed to a factor now that a lot of people that are eligible for subsidies now is greater than it was prior to April 1st. That now group plans are not always best for the business. It depends on the factors. So we have to do a lot of we need to analyze that to really look and see what is going to be best for that business. Is it going to be a group plan? Is it going to be individuals? Should the business go ahead and set up an HRA? So those are factors there that we really want to let every business know, because they could be spending more money than they need to.
The subsidies in the past, the way it worked, and I didn't much care for this affordable healthcare because it truly wasn't affordable. Speaking on behalf of entrepreneurs, our healthcare costs have risen extremely high. Our deductibles are extremely high and our monthly premiums are high. But when they did do the affordable healthcare plan a couple of years ago, Antonio, you got my views on how I felt about it. It was not anything. And then you got punished if you you wound up getting punished when you did your taxes if you exceeded a certain amount of revenue because you weren't in the right. I mean, it was just a big mess, in my opinion. I just,
Well-
anything, in my opinion, anything, sorry if anybody works for the government on this call, but I'm going to say it like it is. Anything that the government manages or touches turns to you know what. So I would prefer not to deal with that if I don't have to. But now that open enrollment is open again, which is really confusing for those who have already picked a healthcare plan earlier when it was open, and now all these changes are happening. Can they go back and reevaluate that and change that mid-year?
Well, there are some situations where we can choose new plans. So let me give you a fact now. So this is, I'm not going to go ahead and give you a concrete answer because
That's another thing government does a great job of never giving you the concrete answer.
well, no, I'm going to take the, I'm going to go ahead. I'm going to go ahead and act like the attorney again. And so
George might be chiming in afterwards then.
So, what we need to do is there's so many factors like you've mentioned, and there's so many changes. And since there are so many different changes, every situation could be different. So when I say I'm not going to say a blanket statement, no, you can't change the plan. And I'm not going to say a blanket statement, yes, you can change the plan, because there could be a situation that you're in that might give you the ability to change that plan if you're already in one today. But the new laws basically are stated that it's for people that are uninsured, so do not have a plan. So if you do not have a plan, that's what the open enrollment period is. But if you're working with me and we've had some major changes, there could be some other options.
Okay.
Is that clear? I mean, without me giving you a wrong answer.
Sure, that's clear.
I don't want anyone to be more confused about this issue than they already were.
Clear as mud, like I say every time we talk.
Yes, clear as mud. I agree. When Heather sends me proposals and I'm like, okay, could you cut it down to like 1 page instead of 50?
Right? I feel the same way.
Heather, we have someone who would like to know if you offer Keyman insurance.
That's a great question. So Keyman Insurance is actually a life insurance product. So probably more Antonio's side of things. You can usually get it from a life and health agent or a financial advisor sometimes carries the right licenses for that. Everything that I do is related to your business specifically. So your general liability, professional, workers' comp, cyber liability, all the things to protect your actual business. But thanks for asking.
Yes, I do have experience in Keyman and corporate bonus plans and a lot of those things. Whenever anyone asks me about business insurance, I just say yes, because whether I'm doing it or Heather's doing it, between the two of us, we're gonna have a policy.
That's right. Just out of curiosity, how many people on this call are back to an in-person environment working in an office? Vicki, you are?
Yep, we have been the whole time.
Awesome. Gotta love that.
Back an average of 3 days a week and go back to full-time office June 1st.
Fantastic.
Yeah.
Heather, I would be back to in person if you invite me over for coffee and let me work in your office.
Okay. You're
Same to
welcome.
you, Antonio.
Yeah, well, I closed my office in March And I have another office that I am just basically renting a room in a conference room. So I have an office, but everything is by appointment only.
That's great.
I'm just curious because some of the things that I was talking about, I'm also dealing with as a business owner. So we came back during COVID. I sent all my employees home and then brought my kids in, and they each got a desk because they all had to go to school. And then once the kids went back, I kicked them out and brought back my employees. But we've seen a real uptick in clients being hospitalized for COVID lately. And these are all clients that we've allowed in the office in the last month to come talk about their bookkeeping, insurance, whatever. And so it's making some of my employees think about whether they want to be either a hybrid or a more structured environment, not so many people coming in and out. And so I was just curious if anybody else was kind of dealing with that. That kind of goes back to that EPLI insurance, and how we have to carefully manage our clients and our employees, and how do you find that balance?
We're still masked 100% of the time, unless you're in a private office with your door closed, and we're 6 feet apart. Everything was measured when they first started us back to any degree. I can remember seeing upper management out with a tape measure, making sure of the distance between desks to protect the employees. We have the option, depending on our position, to work a couple of days a week from home. And I think if someone was truly uncomfortable coming back, I work for Ant Credit Union, I think Ant would work with them to any degree necessary. Like I said, we're still masked when we're in, and we're 6 feet apart, but we are being asked to return to the office June 1st.
I'm also an Ant participant.
Member?
Yeah, member. So I appreciate that, and I appreciate that they wipe everything down before you even walk up to it, right? You go to a grocery store and you think, okay, I have a mask and I have to be 6 feet away, but I'm touching the same keypad you just touched. Like,
right.
So thanks, Ant, for thinking of that.
Well, I hope we take good care of you.
You guys do.
As most of you know, the chamber has been operating when we were in shutdown in total virtual mode and then hybrid mode, and we've been hybrid ever since. But we are starting to look at specific events and slowly transitioning it to in-person only. So the first one that we're going to do in-person only without it being hybrid, is we're seeing the decline of less people on the hybrid on the virtual side, which is a cost for the chamber to endure an additional cost. So we're looking at June, the first Friday in June, that we'll be just doing first Friday in person moving forward. And then we'll continue. The luncheon will be hybrid. We'll monitor the attendance on our wireless platform or a virtual platform and determine when we need to make changes there. But I think we will definitely have our biggest event of the year accolades be hybrid for sure, just because of the sheer size of the event, and we want to be able to capitalize everybody to be able to attend. And I think some people will want to attend virtually for that event. But we're being told we can have a little over 400 people at the Antlers as of today. That could definitely change when August comes around.
Mm-hmm.
Hey, Lola, at the luncheons, are the tables still going to be limited to just 3 people?
There right now, I think there are 3 to 4 people. I know we were just 2 or 3 at First Fridays, but that went up. I think we had actually 4. Was it 4 people? I think Vicky, you were there, right? I think we increased it to 4. So it'll probably between.
It was at 4.
Is it 4? Yeah, it'll probably go up to probably 4, somewhere along those lines.
It seems like the luncheon was at 4 as well.
Yeah, it could be. I think we might have changed it to that number. We're easing into it as more people are getting vaccinated, more people feeling comfortable to come. We still do the mask required type of situation, but of course, if you hit the national news today, now that's all up in the air. I love it when the CDC and the White House don't agree eye to eye on things. So it's an interesting. That's what I said. Government just always isn't clear about things. So you just never know what you get with them. But
Well,
yeah,
El Paso County is spiking again to some degree. So I think staying on the side of caution is wise.
yeah, I think we're a lot better off than I think our counterparts in Denver. I was on a call this morning. We are partnering, by the way, with, if you haven't seen it, an email went out today. It was a little late on their end to get it to us, but we're partnering with the Colorado Women's Chamber in Denver on getting women back to work. It's going to be a panel, getting women back to work, and it'll be on the 19th in the evening, a Zoom panel. And there's several of us that will be facilitating that. I think I'm facilitating one of the rooms to talk about how we come together as a community and as a state to handle this big impact that the pandemic has done to women in the workforce. So we were just talking about that. You could register, it's free to register for that event. And we're partnering with the Women's Chamber and, like I said, Denver on that. And when I spoke with them, they still have not done any in-person stuff. So they're thinking about doing a hybrid starting in June. Theirs has been nothing but all virtual. So Denver's been a lot locked down, a little bit more than El Paso County has been.
So is that event, you said the 19th. So Wednesday of next week or the 19th of June?
No, Wednesday of next week.
Okay.
Yeah, Wednesday of next week, the 19th, May 19th. It goes from 4:30 to 6:30. And there's a link, a Zoom link. I could put it in the chat box here for you guys so you could have it. But you could also check on our website, and we just sent out a notice on that as well.
Okay. Thank you.
Any other questions?
I just want to add a couple of observations. One, I've only known Heather the last 3 or 4 years, but she is a seasoned entrepreneur like we are and insurance executive. And I've come to respect that talent. And also Antonio, we go back probably 8-10 years as ambassadors with another chamber. And it's always fun to see him out and about because he certainly knows his business. And we could all do well by using them whenever we have questions or want to have them embrace us when we're having insurance issues and help us along the way. So hats off to both of you and thank you.
Thank
Yep.
you, Doug.
Yeah, thank you so much, Doug. That was super sweet.
The other thing I'd like to, allow me get my picture back up. The other thing I'd like to mention, since we have several people from the insurance side of things, George is on from Employers Resource Council as well. We're looking at some, and I want to toss it out to this group because we're reviewing some of our past relationships and partnerships, and we're looking for something very competitive for small businesses. So one of the things that I'd like to look at is looking at workman's comp insurance. If somebody wants to step up or offer some type of special discount for our members, some type of exclusive offers, that would be great. To get in touch with me directly, you can email me directly at ceo@scwcc.com, and I'd love to have a conversation about that. And then also, we just added dental with Perfect Teeth, a contract for our small businesses and members to get dental care at discounted rates through Perfect Teeth. So we just did that with Gemma. Just earlier this year, we announced it at our State of the Chamber address. So I would like to explore some opportunities for discounted medical insurance for group rates or small individuals as well. And if you're aware of any of those opportunities, to send them our way to the chamber so that we can negotiate something on behalf of our members.
Any other questions? Lola, did you have any other announcements that you wanted to make, or Julie, any upcoming events?
As far as announcements, we do have a sunset meet and greet coming up here shortly. So it's going to be at Fabrique. Please mark that on your calendar. Everything is on our website for sure. Also, nominations are out for accolades. So if you know of any professionals out there that should be nominated as a young professional, minority-owned business, member of the year, business leader of the year, I know there's many people that stepped up during these challenging times and did a great job in getting their businesses or their employees through this. So please take the time to nominate, because those nominations will be closing soon. We want to make sure those all get in for accolades. Mark your calendar, accolades will be August 17th at the Antlers for sure. And so that's when we're going to have it. And then lastly, for those that didn't make the State of the Chamber address that I did a couple months ago, we talked about providing benefits for our members. So if you're interested in receiving the Business Journal for free, if you're a member, as well as the Book of Lists, we now include that as part of your membership dues. It's a great opportunity. There's links that we've sent out to everybody. And if you want more information on that, you can email us at info@, and we can make sure that we get the links out for you to sign up and register for that. And if you want to run any commercials, we said we'd take care of advertising this year for our members. And as you know, we struck a contract with iHeart, which will offer all of our members and any new members 30 commercials produced with your branding and carry your message. That's an incredible offer. Membership alone pays for that and then some. So if you haven't taken advantage of that, I would definitely sign up for that. We sent out notices via email to everybody. So take a look at your inbox, or maybe it might have gone into junk mail. You might want to double check it and then take advantage of that opportunity as well. We're expecting a few more things to pop in, and just be prepared. We've already had long conversations with the GMs and executives at Fox News, and be on the lookout. I think you're going to see some interesting stuff coming up from the Women's Chamber on that. That'll help support our members as well.
Way to go.
Nice work.
So much, Lola. Thanks for all your support for us. I really appreciate it.
You're all welcome. I know it's been kind of challenging last year, and we're still kind of in, trying to get out of the woods this year. And we just want you all to know that myself and our board of directors is 100% committed to be serving each and every one of our members through these challenging times. And we will do everything to use our influence to provide you the resources that you need to be successful out there. And please don't hesitate to give us a call if you have anything that you need to know about, or need a connection or an introduction. We're here. Julie's got my schedule back to back booked week after week on stuff. So we're here to support each and every one of you.
And our luncheon is this coming Tuesday as well.
Yes. Luncheon is this coming Tuesday. So register, come in person. We like to see smiling faces.
Okay, well, again, I'd like to thank Benton Capital for sponsoring this event today. And if you have any other questions, you can either contact me or info@scwcc.com, and we'll get that information that you need on any topic.
Great. And
Thanks so much, everybody.
Yeah, thanks.
thank you, everybody.